Numbers reveal new details about cancer rates in children. Since 1998, we have seen the number of cases rise by 1,300 per year. Also, cancer in the colon has tripled in the past 2 decades. So what is to blame? Studies show it could be our modern lifestyle. So joining me this morning is Dr. Scott Ackerman, a cancer specialist, to tell me this is really scary research. And some people would say, how do you know this?
That's an excellent question. Good to see you this morning, Vic. This is research out of England. Okay. And England's great because they have this national health system, which is great to be able to gather data. And they have lots of data about their patients. We here in the United States evaluate data on cancer, on cancer numbers as well. And the American Cancer Society does a great job with that, as does the National Cancer Institute. And what they saw in this English study was that the cancer incidence has gone up over the past 2 decades in children. Well, it has in the United States as well, but it's a very small number. Really, it's only gone up about 0.6% per year since the 70s.
Okay, but we read there the modern lifestyle. That's what we're seeing. Everybody's got a smartphone. Everybody's kind of glued to their computers. They use microwaves.
So in that study,
what do we need to be concerned about here?
So I think that's a good concern. In that study, what they showed was that colon cancer increased 3 times, as you said, in an English study. Here in the United States, we haven't seen that big of an increase in colon cancer in kids, but we have seen an increase in colon cancer in young adults. And I think that's translated to, that translates from 2 things. One, this level of inactivity. As young kids aren't getting out and doing that much activities, they're sitting around more, also eating maybe a diet that's higher in fast foods and fatty foods. And number 2, we don't do colon cancer screening on young adults like we do in older adults. In the population over the age 50, colon cancer rates are actually declining because of colonoscopy and colon cancer screening. We don't do that in younger adults, and the younger adults are ones that have had many years of inactivity.
And when it comes to cancer, early detection is key. That's really the lifesaver here, above anything else.
Absolutely, and it's finding cancer early through mammography, through colonoscopy, those sort of things. We can't really do that in kids because in pediatrics or in children, there isn't that much cancer. There's only about 15,000 cases in the United States every year, and to do screening on those people would be a lot of screening, which would find a lot of false positives.
And I know that you and the people at the Ackerman Cancer Center are really nationally and world-renowned for your work.
Thank you.
The question is, what should we do?
What should we do is lead a healthy lifestyle. We know that obesity and lack of exercise and being stagnant increases one's risk of cancer. We already know about environmental factors and smoking rates are going down. People know about smoking and drinking, and we've gotten as far as we can with that. But if you want to prevent cancer, the best thing to do now, once you already eliminate tobacco and environmental factors, is through exercise and keeping a proper body mass index.
And also healthy eating.
Yes, which goes along with that. Healthy eating leads to a better body mass index.
Should people go the organic route and the whole foods route as compared to processed, which we hear so many bad things about processed and unnatural materials in food?
Yes, you know, in the processed foods are a lot of other chemicals, and a lot of these chemicals have been associated with certain kinds of cancer. And so I think going organic not only prevents you from ingesting those chemicals, but also it keeps you more cognizant of the foods that you're eating. And people that eat that way tend to have a lower body mass index, tend to be a more ideal weight, and have a lower incidence of cancer because of that.
Dr. Scott Ackerman, thank you so much. Thank you for saving lives. We just went over a lot of information here. Don't worry, we will be posting this segment online right after the morning show. You can find it on news4jax.com under the morning show page.